Hello, I'm Don Mackey, the LCAT director, and I'm here with Health Director Amy Petrosky with another update on COVID-19 from the town of East Long Meadow. Amy, thanks for coming by. Let's just start, if you want, with the most recent weekly report from the Mass Department of Public Health.
Sure. Yeah. Dawn, thanks for having me. We got a new report that came out last night around 6 p.m. from the Massachusetts Department of Public Health that has our transmission rates still in that red category. So this is our third week in a row of being considered a higher risk for transmission. We had in the last 14 days, and the dates run from Saturday to Saturday. So yesterday's report finished on October 24th. So as of yesterday, we had 43 cases in the last 14 days. That's more than double than the 14-day prior. So that, I would say, that's a pretty significant increase for a community of our size. I do know that I'm pulling it all up. The average daily incident rate per 100,000 is higher for us than it is for places like Springfield and Holyoke. So those are just some things that we watch to kind of judge our levels of transmission.
Right.
So far for next week's report, as of right now, so again, next week's report ends tomorrow, but as of right now, we're at 60 cases. So we're already in the next 2-week cycle higher than we are for this 2-week cycle.
And so the what that spread looks like, and again, you've mentioned this in our prior updates, but this is spread within the larger East Long Meadow community. It's not isolated to, for example, long-term care facilities, or this is a different outbreak. Looks different than it did in March and April.
Yeah, this is drastically different. Actually, a lot of the people of my peers in different communities are talking about how much different this is, and how the work that we're doing has changed. You are correct that all of our transmission has occurring residentially based. We're seeing a lot more pediatric cases in the last couple of weeks than we have, and what that means is previously in March, April, and May, when a lot of our cases, 2/3 of our cases were isolated to long-term care facilities or assisted living. We basically would work with that patient, but they were receiving direct medical care, and our reports would come from a director of nursing. Now it becomes a lot more labor intensive because we're calling your average person who's living in a house, who has different needs, more contacts. Household contacts are, one of the number one, they call them a cluster because anything over 2 is a cluster. But that's the number one way across the state that these are spreading. People are bringing it into their house, and that's how multiple people are getting infected. It also means that we're dealing a lot more with schools, right? So in the past, even though our schools aren't functioning entirely in person right now, we do have some students that are in-person learners, and we do have athletic programs. So working really closely to make sure that we're protecting those students, and with the rec programs.
So do you want to go back to, and I didn't mean to sidetrack you, but if you want to go back now to the report and the implications of us hitting the 3-week threshold?
Oh yeah, so because of the high levels of transmission and that being sustained over a 3-week period, the state is requiring that we reverse back to phase 3, step 1. And some of the changes that most impact the town of East Long Meadow refer to our gyms. So under what we were previously operating under, they were allowed to be open at 50% capacity, and now they're open to 40% capacity. Restaurants were allowed to have music to accompany the diners, but no singing. But now they're not allowed to have any wind or brass instruments. And the reason for that is as we increase our respiration rates, the more of the viral load that might be brought into the environment where people are. So that's why they're cutting back on that. And the final one is the retail fitting rooms. Under the last round, we were able to have all fitting rooms open, and now it's really just only when it's absolutely necessary. So those are some of the businesses that are impacted under this change.
As far as the messaging, you sent out a robocall to the community last night. How has your messaging changed to the community, and are you asking people to refocus their efforts based on this not only sustained being in the red, but actually accelerating growth of or spread of the virus?
Yeah, part of the reason that I decided to do a robocall last night was because I thought the message needed to change a little bit. Everybody knows, whether they choose to comply or not, that masks are a way to protect yourself and those around you. They know that keeping 6 feet of separation is the best way to remove yourself from the virus. But what we're seeing now with this increase of cases is a lot of other changes that I think could make a big difference in the level of transmission within our community. So that was the primary message from last night, was information that I'm seeing firsthand from these 43 cases this week and historically that can make a difference. And one of those is what we're finding is people, we touched on this a little bit last week, is people are really reluctant to share their contacts. And I'm sure there are a variety of reasons for that, but we have people who, when they're contacted, are saying, oh, I've already let them know. I've already let them know when they're going to get tested. But that creates a little bit of a problem, not only for keeping track of the exposures and how we can properly contain it, but it also doesn't get them the support services that they need. So if you were a close contact of mine, and I was called by the CTC and I said, I've already let my contact know, Don is well aware. Don, if you don't get a letter to return to work, so your employer would require a letter for you to come back to work. I can't give you a letter unless you're listed as an official quarantine. And secondly, there are some residents in our community that are accessing services because of the restrictions that having COVID or being quarantined puts on a family. So if 3 of you have COVID and you don't have family members around, who's doing your shopping? Who's bringing you the essentials? So by not being listed as an official contact, you lose out on a lot of things. And it also prohibits our ability to prevent the spread before it gets bigger. So if we know you had 3 contacts at a gathering or a sporting event, we can't then let other people know once those people test positive. And it's harder for us to make those connections. So we're really hoping that people list the contacts. There's no penalties. If they don't want to get calls as their contact, they can opt out of those calls, but at least listing the names so we can have them in our system is really helpful. Another thing is that we talked about last week is when you're exposed, the instinct is to run right out, but waiting that 5 days from your exposure day really is going to help you get a better idea of if you're infectious or not and allow you to protect your family. Answer the call. If you see something come across your phone as mass COVID team, then they're calling to either let you know that you're a confirmed positive or a close contact. And answering that and having that discussion will not only give you the information you need, but allow us to protect the other residents within the community by the information that we're able to get from you. And also, if you're tested, stay home. So if you're tested because you've had an exposure or you're not feeling well, stay quarantined. We put a great graphic up on our Facebook page and website this week from the Mass Department of Public Health that explains what you should do post-testing. And it's a little infographic with some great information there. But you act like you're quarantined, because if you continue to go out and do those things, you're exposing many more people in our community. And, you know, a lot of people feel like that if they get COVID, they're going to be fine. But when you start to expose it to other people who may not be fine, that's when we start seeing more complications and implications from the virus in our own circle.
Right. So are people not following the guidelines? Is that what accounts for this spread in the community?
Well, I wouldn't even say that, because even if we are complying to the recommendations, wearing a mask, staying 6 feet apart, there's still the ability to transmit this virus while still being careful. So, you know, I would hate for there to be a negative implication for people who get this virus to
Yeah.
feel
All
like
right.
they did something wrong, or for community members to say, hey, they have the virus, they must have not been doing what they should be. And not only can you still get the virus, it's much less likely, but it can still happen. But also, if 50% of the people are asymptomatic, we could be doing things and complying with all of these and go to do our sporting events. You know we feel fine. We complete our attestation that we feel fine, but we're asymptomatic carriers. So I wouldn't say that our community has a high level of transmission just based on people not complying with the governor's orders.
And Amy, what about people who are feeling especially isolated and maybe feeling some significantly increased anxiety as they hear this news and see the, rate of growth or spread of the virus in the community going back up, and feeling some concern about that? Are there What are there for resources or tips for people who feel as if, we're heading back into that isolation of the early spring that I mean, it was really difficult for people. And there are people who are already isolated who need some ways to deal with that and to feel safe about maintaining contact with their family and that kind of thing. So just anything along that line that you can share would be great.
Yeah, we're certainly going back into a period where it's harder to socialize outside. I mean, we're doing this interview today and it's snowing outside. So we're moving into the weather stages of New England that are going to make that a little prohibitive. If I would suggest that if people are really feeling anxious or struggling emotionally, that there are resources out there that can help support them in that process. There's a disaster helpline. If you are more comfortable with texting, you can text Talk With Us to 66746. All of this is free and confidential. And I would suggest also being creative in the ways that we try to keep those social contacts. And if you're not as comfortable with Zoom, or Zoom just isn't, or any kind of electronic platform for communication is not enough, not what you need. Thinking about talking through windows or sitting in an open garage with lots of airflow where you're still protected from the elements, you're still 6 feet apart, you still have your mask, and there's a lot of circulation happening. You're not sitting in a living room with the air flowing back and forth between each other. And masks are a great way to help protect us, but they are not always protect 100%. So trying to find creative ways, going back into the winter is going to be hard for all of us.
Right. And also perhaps just the time of exposure, right? So that if you limit the amount of time that you are, in an environment where there is more risk, the less time you spend, the less concentration there's going to be of that viral load and is presumably somewhat safer, right?
Correct. Yep. So time is a big part of exposure.
All right. Well, anything else that you want to touch on for this week's update?
I think that's it. We'll do a little teaser. Thanks. DPH just released some Thanksgiving guidelines that I think I'd love to get back together with you and talk about those. Maybe after Halloween is passed and people are starting to think about the best way to integrate family activities to Thanksgiving.
All right. Well, that's great. And thanks for doing this. And people can be reminded that the updates that we've done so far are available. They are both on the cable channel 191 throughout the course of the day and the week, as well as at our YouTube page, LCAT 01028. And we'll, plan to get together in a week or so and, talk about those Thanksgiving guidelines and whatever else is relevant at that time. But these are very helpful. I know they're getting a lot of exposure and a lot of views. And I think it's a great service that the health department, you provide a terrific service to the town as it is, but I think getting the information out there on a regular basis and making it available in, you know, multiple formats is terrific. So thanks for, you know, jumping on these calls. This is great.
Yeah, of course. Thanks for the platform.
All right. Health Director for the Town of East Long Meadow, Amy Petrosky. And I'm Don Mackey, LCAT Director, and we'll see you at the next update.